My name is Elizabeth Almond. I am a registered nurse and I work currently at Memorial Hospital, University of Colorado Health in the emergency department. I manage a team of nurses that are called forensic nurses. So we work with people who essentially are at the intersection of medical and legal issues. So the patient populations that we see are often patients who are experiencing sexual assault, domestic violence, child abuse, elder abuse, and human trafficking. So I'm here today to talk to you a little bit about the red flags that we see as first responders, as nurses in the emergency department, specifically with children that are experiencing abuse. So as we talk about the red flags going forward, I think it's important for us to understand the demographics of the child deaths that we saw in El Paso County in 2011. So as many of you know, in 2011, we had 10 child deaths that were related or due to abuse and neglect. Of those 10 child deaths, what we understand is that 8 of the 10 were a result of abusive head trauma. So essentially that's bleeding inside of the brain that's caused by some sort of blunt force trauma or impact that can cause brain death, and in these particular cases did cause the death of these 8 of the 10 children. What we also know when we look at these numbers is we wanted to look at the age of the perpetrators or the people who inflicted this trauma on the child. We know that 6 of the perpetrators were 25 and under, so our younger parents. We know that 4 of the perpetrators were over the age of 25. But in general, what we're looking at in terms of demographics and the perpetrator are the younger parent group. We also know that 2, and this is where I think it gets really interesting, is that we understand that 2 out of the 10 children had previous DHS involvement. I think a lot of times in the community, people assume that when these child deaths occur, that they're occurring and that DHS already knew about these families or these kids. But what we understand is that only 2 of these 10 actually had previous DHS involvement. And so this is where we as first responders are really important, because what we understand is that we truly are the eyes and the ears of this community. We're the people in and out of these homes. For us as nurses, we're the people seeing these patients come in and out of our emergency departments and urgent cares. And so just a reminder to all of us about how important it is to be those eyes and ears and to make the appropriate report when you do have a red flag or a concern for child abuse and neglect. Okay, so one of our biggest red flags that I would like everybody to consider is domestic violence. This gives you a brief understanding of what domestic violence is. Essentially, a lot of people refer to it also as intimate partner violence, but it's a cycle or a pattern of violence that occurs within a relationship. We know that this can occur between a man and a woman, between a woman and a woman, as well as a man can be perpetrated by a woman as well for domestic violence. So we see same sex, and we see domestic violence in all kinds of situations. But essentially, it's a cycle, so it's a pattern that comes and goes in a relationship. We see physical violence as part of domestic violence, as well as sexual violence. We can see threats and emotional abuse that occurs within the relationship. Where this is important for us and what a lot of people forget is where kids come in. So oftentimes kids are in these homes or involved in these relationships where domestic violence is occurring. What we understand is that approximately 15.5 million children in the United States will witness domestic violence in at least in 1 year. So we understand that 15.5 million children will witness domestic violence in the year. 7 million of these children live in families where severe domestic violence occurred. And there's all kinds of studies that suggest, what the relationship with domestic violence and child abuse is. But essentially what we understand is that studies show that anywhere from 30 to 60% of children who are witnessing domestic violence are also maltreated in those homes. We know that domestic violence is statistically the strongest predictor and indicator of child abuse. So we know that a kid who's in a home who's witnessing domestic violence, we know that they're more likely to experience child abuse than any other child in our community. We also understand from the perspective of sexual abuse that a child who's in a home where they're witnessing domestic violence, that they're 150% more likely to experience sexual abuse than a child who's in a home where there isn't domestic violence. So this really gives us a sense and hopefully opens our eyes as first responders that this isn't just an issue between 2 people, but domestic violence is absolutely a community issue and an issue that absolutely involves and affects the children in our community. Okay. A lot of times when we're walking into homes or we're with families where domestic violence is occurring, what we think is, well, everybody's cooled off, it's okay now. But what we understand as nurses is that there are not only acute consequences to experiencing domestic violence, so kids who are terrorized and afraid, but there's also long-term health consequences to these kids that are experiencing domestic violence in their homes. We know that kids who are in utero, so inside the abdomen essentially, and there's domestic violence going on during pregnancy, we know that those kids in general are going to have health consequences just even experiencing it inside of the uterus. So we know that children who are exposed during pregnancy to domestic violence, that they can have behavior that is more aggressive. They can be anxious, depressed, and often hyperactive. We also understand that there are long-term health effects on kids who are experiencing or witnessing domestic violence. We know that these kids are at increased risk for tobacco use, substance abuse, obesity, cancer, heart disease, depression, and unintended or adolescent pregnancy. So again, just trying to make the point that this isn't just a here and now situation, but this is something that affects kids long-term and their health as well. Okay. So now we get into a little bit about emotional abuse. This is something that, when working with nurses, I find we often have a really hard time putting our hands on. We all hear kids or parents who are talking to kids that make us feel uncomfortable, but what are the red flags and where do we draw the line with what's appropriate and what's inappropriate related to emotional abuse and children? So essentially what you want to look at for red flags, you want to look at the behavior of the child as well as the behavior of the parent. So in general, kids who are experiencing emotional abuse, we know that they often show extremes in behavior. So they can be overly compliant or be demanding. Sometimes you'll see a kid who comes in who's very protective of their parent, so acting more like the parent or protective of the other kids in the family, where you would expect a parent to be playing that role more. We can also see so again, the parenting of the other children, frequently rocking or headbanging. Sometimes we'll see a delay in their physical or emotional development, and sometimes we'll see emotional problems that can involve suicide attempts or suicidal ideation. When we're looking at the parents who are imposing this emotional abuse on children, what we can sometimes see is that the way they talk about their kids. So are they constantly blaming, belittling their child? Do they berate their child? And one of the things that I use as a nurse when I'm working with a family to kind of, again, get more meat or grab onto that emotional abuse and the red flags for me is to just talk to a parent about their child. So tell me about your child. What's your kid like? And really get a sense for how it is, what's going on in that home and between that parent and that child. Is the parent unconcerned for the child and refuses to consider offers of help for the child's problem, or does the parent overtly reject the child? So these are some red flags that hopefully you can kind of grab onto to give you a sense for when it is that you need to make that call to DHS or to law enforcement. Just again, red flags to alert us in the community as first responders to child abuse. Okay, so now we're looking at physical abuse. In some way, physical abuse is the easiest for all of us to look at. You know, clearly a kid with 2 black eyes is going to be concerning. But what we all know is that kids get injured, right? So kids get injured on a regular basis. Any of you who have kids understand that as well. It's part of being a kid. So when we're looking at physical abuse and injury to a kid, what we really want to be looking at is the injury consistent with the history? So you have a 2-month-old who comes in with a gigantic bruise or hematoma on his forehead versus a 1-year-old or let's say a 14-month-old who comes in with that bruise. Very different situations. So at 14 months, we expect a kid to be toddling around, to learn to walk, running into furniture, potentially hitting his head on a somewhat regular basis. But a 2-month-old who's not sitting up, who's not rolling or crawling or moving, we're going to be a lot more concerned about that injury to the child's head. One of the injuries that we see a lot in the emergency department related to child abuse are injuries behind the ear. So sometimes that's an injury behind the ear or on the ear that I'd like a good history with. It's an area of the body that's often hard to get, but we do sometimes see it with pulling or slapping of the ears. But I'd want a good history from the kid and the parent as to how a child got that type of injury. Again, just asking the question, looking at the whole picture, is this injury consistent with the kid's history? So in general, where we don't expect to see injuries are on non-bony prominences. So when we see injuries to an abdomen, to the inside of the thighs, those are really concerning areas to us, especially the abdomen and the inside of the thighs. If I'm seeing injury on a kid's elbows, on their knees, on their shins, if they're a toddler, on their face, that's not as concerning to me because that's an injury that is normal and that I expect to see as part of childhood. We do know that sometimes as well, kids, we do see signs and symptoms of strangulation on kids. In general, for that briefly, what we often see with that is we will see petechiae, or pinpoint red dots on a child's face, essentially anywhere above the point of strangulation. You'll sometimes see it inside the eyes, the mouth, and sometimes you'll see scratch marks on a child's neck from them trying to remove the hands of the perpetrator off of their neck. Anytime there's scratch marks on a kid's neck, that's a red flag to me, something that I want to look into a little bit more. Of course, if there are unexplained burns, bites, broken bones, or black eyes, does the child seem frightened of the parents or shrink at the approach of adults? So again, just looking at the bigger picture as we look at injury with kids and understanding that kids do get injured, but is there a consistent history related to that injury? Okay, so next we're going to look at neglect and giving you the red flags for neglect related to child abuse. So we want to consider neglect when we see a kid who's frequently absent from school, when we see a kid who's not consistently getting medical care or immunizations. So when we have a kid who comes in who potentially needs a physical therapist, an occupational therapist, a follow-up with a respiratory therapist, and they're not getting that consistent care. So either in school, with their medical care, with their immunizations. A kid who maybe needs glasses or their dental care is really poor. Sometimes that can be a sign to us that these kids are in situations where there's neglect. Are they consistently dirty? Do they have severe body odor? Do they lack sufficient clothing for the weather? And who is at home to provide care? Do they state that maybe there is no one at home to provide care? And are the younger kids providing care for, the older kids providing care for the younger kids in the home? So again, just looking at the bigger picture in all of these situations. So is the environment injurious? Is the environment age appropriate? So going back a little bit to what Karen spoke to you guys about in part 1, which is just looking at, we have a little toddler around, somebody's growing medical marijuana, right? So we have a toddler in the home versus a 14-year-old, and who has access to that? And is it appropriate for the kid? Is the kid developmentally delayed? So again, just looking at the bigger picture and determining whether or not the environment is appropriate for the child at their particular age. So kind of the key concepts that we want to bring out to you guys as first responders for red flags in child abuse are looking again at the demographics. So we know these kids are little. So related to the 10 child deaths that we had in 2011, all of them were under the age of 3. In general, we have young parents. We know, as I said before, that domestic violence is one of the highest indicators of physical and sexual abuse for a child. We also want to look at the injury. Is it consistent with the history? And is the environment developmentally appropriate for this kid? So these are just some pictures and examples of looking at, is this just a dirty home? So maybe it's appropriate for a 16-year-old who can manage their own room and their own space. But is this appropriate for a child who's toddling around or crawling, or a 3 or 4-year-old who doesn't have the ability to clean this space? Again, just examples of looking at this home. So red flags, times when you might want to make the call, depending on the age and the developmental age of the child as well. And these are just pictures of marijuana plants. And just cleanliness, of course, in your bathroom and your kitchen. And finally, we just want to get across to everybody that as first responders, we don't expect you to fix all of these problems, but you are the eyes and the ears for our community and for these kids. So we know that people who are in these homes, people who are seeing these kids in our emergency department and urgent care, that you are our first responders. You are the eyes and the ears and the voice for these children. So when you do see these red flags, that you make the appropriate call to either Department of Human Services at 444-5700, or go ahead and make the email if you don't have time to make the call at that time. And then, of course, to call the appropriate law enforcement agency depending on the jurisdiction. Thank you.